And welcome back from the break. I'm Mabel, Jong. I'm reporting to you live from the World Healthcare Congress here in Washington, D.C. Thanks so much for joining us. And we have in our studio right now a panelist for a panel that's coming up tomorrow. And John Clay is Benefits Advisor at BetterSource Benefits, and he's going to be speaking on the Next Gen Benefits Advisors Toolbox. Hi there, John. How are you doing?
Fine, Mabel. Thanks for having me.
And what does that refer to?
Well, the Next Gen Benefits Toolbox is just what it sounds like. It's the set of solutions and strategies that we present to employer groups so they can help better manage their cost of care, their health plan in general, and it's an exciting thing to break out any new tool, especially when they've not seen them, and just a few short years ago they were not available. And some of the things that will be discussed on the panel also are the healthcare supply chain management. Could you give us a quick rundown of that? Well, the tools that we use to manage the healthcare supply chain basically take apart each component of the healthcare delivery system: hospitals, outpatient services, doctors, drugs. And part of the toolbox is to find the appropriate partners to help exclude waste, fraud, and abuse from those components of the health plan and make it more efficient, make it more cost-effective, and deliver better quality.
Do you have an overview of what tools should be in the toolbox?
Well, you should have a high-performance third-party administrator. You should have your repricing partners and reference-based pricing, or at least a strong network of discounted services. You should have a good fiduciary pharmacy benefit manager, and you should have a medical management partner that helps act as the central nervous system to your plan.
Has that changed as the healthcare landscape has evolved?
Oh, absolutely, because anymore you've got an interesting dichotomy. You've got fully insured plans who actually don't manage as well on the under 65 population, while at the same time these same companies manage the 65 and over population very, very well, both with equal profitability. So it's an interesting study in economics and business.
For sure, for sure. What are some of the things in your panel tomorrow that you want to leave with attendees?
Well, that there is hope out there for employers, that you can control costs, you can deliver a better quality outcome with less risk at a lower price. Better healthcare outcomes with less risk for a lower price.
Well, it sounds pretty simple, but it sounds like also people have a tough time with that formula.
Well, it is because it's so simple.
People make it harder than it should
absolutely. Be? It can't be that true.
Oh, okay.
It can't be true because it's so simple. And when you stop and think about it, it's what every manufacturing concern does in breaking down their assembly process, manufacturing process. We're just implementing that same strategy in a health plan.
What are the trends that you're seeing with clients that you work with? Their most frequently asked questions, if you will.
Can I measure it? Is it measurable, repeatable, and manageable? Because if you can measure it and it's repeatable, then it's manageable. The main thing, I guess, is that when I sit down with them and say, how would you like to save 20 to 40% on your healthcare spend, they lean in for that.
You've got their attention.
Yes.
And what is the first thing that you advise them to do in order to achieve that?
Fire their incumbent broker and hire me.
And secondly?
Secondly, I ask for data. Honestly, I ask for data to do an impact analysis to give them a thumbnail approach to what can be achieved with our solutions and strategies.
Okay. We love seeing you here, John. Loved having you at the conference. How is it going for you so far?
Oh, very informative. We're learning quite a bit. We're meeting new friends and great influencers in the healthcare landscape across the country. Leadership and knowledge, a great combination.
All right. John Clay, ladies and gentlemen.
Thank you,
Thank you
Mabel.
so much. John Clay of BetterSource Benefits. And stay tuned, we'll have much more to come. Thank you.